Hello everyone. Today we'll be learning about hydrotherapy. So in this presentation we'll be learning what is hydrotherapy, what are the benefits on a human, both healthy and diseased individuals, the effects of hydrotherapy. So to begin with, hydrotherapy means it is derived from two words, hydro meaning water and therapy meaning treatment. So it literally translates to treatment using water. So in this method, we use different types of water forms in solid, liquid, and vapor states to treat several diseases and also to improve the health of a healthy individuals. It is either applied internally, where it is consumed or absorbed, or it is applied internally into the cavities through irrigation like it is done in enema, and externally where it comes in contact with the skin surface. Now, what are the general benefits? It is used for healing diseases, several diseases. It is used for relaxation and rehabilitation. Now, let's get into details. Where is it evolved? It is believed that hydrotherapy is evolved in not just one country, but it is followed in several countries like in Egypt, India, Greece, and Rome. In India, especially, we have such religious practices which are inbuilt in our scriptures and followed from the ancient times, where we take baths or dips in the seas either in the morning during the sunrise or in the evening during the sunset. It is believed has medicinal properties and also benefits the bodies. And in the Western countries, the Hippocrates used water for fever and to relieve pain. Nowadays, in modern hydrotherapy, we see a lot of water therapies that are followed in spas and also at several clinical practices. So they're used for both relaxation purposes and also for therapeutic purposes. Now let's understand the properties of water. First, it has high heat capacity and thermal conductivity without changing its own temperature. Let us break this down. For example, when a water body comes in contact with extremely hotter temperatures, the water doesn't immediately raise the temperature. It gradually raises its own temperature but transfers the effect of the heat to the body. And in the same way, in the cold temperatures, the water loses its heat gradually and doesn't just drop. That means it holds the temperature for a longer time, and thus the effects are carried for a longer period of time. So the effects of water on the human are carried for a longer period of time because of its capacity of resisting, retaining the heat, and also the thermal conductivity. And buoyancy reduces weight bearing stress. What does this mean? Let me give you an example. When you are on the land, imagine lifting a 60 kilo human being or an individual, and imagine lifting the same individual in water. Right. On land, it is very difficult for a normal individual to lift a 60-kilo person, but in the water, you can easily lift and you cannot feel the weight of the individual or any other weights. This is due to buoyancy. So, buoyancy reduces the weight bearing stress of the object. This is a natural property that water contains. Then comes hydrostatic pressure, which helps in improving circulation. For example, water can also be regulated with pressure. When you pour water slowly on a body surface, you can find the effect differently, but when you jet spray the same water at the same temperature on the body surface, there are differences on the effects that are created. This means there are hydrostatic pressure with the same temperature or form of water, which may alter and helps in improving the circulation. Now, as we all said, the major part of hydrotherapy is treating externally. That means the water comes in contact with the external surface of the body, which is the skin. So let us understand the functions of skin to begin with. First, skin acts as a sensory organ. What does this mean? You feel the touch, you feel the pressure, you feel the temperature, you feel the uh, danger, you feel the warmth, you feel the cold, you feel things when something comes closer to your skin surface. This is because of the nerve endings that are present on the skin surface, which help you to receive the signals from the external sources and pass it to your brain, and that is how we react to the stimulus. For example, when a block of ice is placed on your skin, you immediately feel it and try to pull your hand away. Or when someone is pressing your hand harder than you can hold it, you try, panic, and pull your hand. This is all because your skin's peripheral nerves sense the external stimulus and we react as these sensory stimulus are passed to the brain. And on the skin, cold is detected faster than the heat. We react to the colder temperatures quicker than do we react to the heat. In other words, our tolerance to winters are comparatively lower than our tolerance to summer. In winters, we shiver because that's the body's mechanism to produce heat, while in summers, we profusely sweat because that's the body's mechanism to reduce the body's temperature. So, all these signals are transmitted through the nerve endings into the central nervous system, or in other words, the brain and the spinal cord. And next function of the skin is it acts as an organ of excretion. How? We sweat. And sweat doesn't just include vapor or water, but also it includes salts, urea, which are the metabolic waste that are produced by the body. For example, urea is generally released by the kidney as it's the process of excretion, but in few kidney disorders where the urea secretion is lowered, skin helps in secreting urea out through blood, through sweat. And when the temperature outside is hot or excessively higher, we sweat profusely to lower the body's temperature. So, in this way, also not in case of temperatures, but in few disease conditions that are linked to the heart or your lungs, you first sweat. That means when your main organs are functioning a little abnormally, your skin tries to help it out to excrete waste. Also, uh, also through sweat, you also try to lose some weight. For example, in hot baths or steam baths, we aim at profuse sweatings with through which the metabolic waste that are accumulated in the body are eliminated out, which helps in improving metabolism and through which there is weight loss. So this also assists in detoxification. Now let's move on to the temperature classifications. How do we know at what temperature the waters are cold or the body is cold or hot? Let's understand. Those temperatures that are below 20 degrees Celsius are considered to be cold. Between 20 to 27 are considered cool. 27 to 33 are considered tepid or normal. 33 to 37 are considered warm, and above 37 are considered hot. So let me repeat. The cold temperatures are below 20 degrees Celsius. 20 to 27 degrees Celsius are considered to be cool. 27 to 33 degrees Celsius are considered to be tepid. 33 to 37 degrees are warm. Above 37 are considered to be hot. Now, what are the effects of cold water? It helps in vasoconstriction of skin vessels. That means the blood vessels are narrowed, constricted. So it helps in the blood flows to the deeper surfaces or the deeper organs, and it reduces inflammation and edema. It increases alertness and improves muscle tone. That means it stimulates the body. And whereas in effects of hot water, it it results in vasodilation, which improves increased skin circulation. It helps in relieving muscle spasm, helps promote relaxation and sweating. Now, let us take an example of cold water. During your menstrual period, if you're bloated or you're if you're bloated and you have menstrual pain, we suggest cold water pack that helps in increasing blood flow to your organs, thus removing the bloating and improving the blood circulation to the uterus. So you feel relaxed. Whereas in hot water, when you experience excessive cramps, hot waters are suggested that helps in increasing skin circulation and helps in relieving muscle spasm. Now, the reflex effects of temperature. The second, skin temperature changes influence internal organs. Now, let us understand how. Cold results in internal vasodilation. As I said, cold constricts the skin vessels, which leads to the flow of blood into the internal organs, leading to the vasodilation of the internal organs. In the heat, it is reversed, where the skin vessels are dilated, resulting in flow of blood from the organs to the skin, where and thus internal vasoconstriction is observed. Hydrostatic pressure effects, that is, water pressure effects. What does this do? It helps in improving venous return. That means it helps in increasing the not only the oxygen supply, but also collects the deoxygenated blood or metabolic waste included blood to the lungs. It reduces swelling. It aids in respiratory function by increasing chest resistance. Now, what are the mechanical effects of water? Like I said, water jet pressure stimulates nerves because the water is released to the body at a particular spot with a certain control pressure that helps in stimulating nerves. So it helps in improving circulation. It is very useful in massage therapies. Effects on circulation. Temperature alters blood flow. And how does this happen? Cold increases blood thickness. Like I said, because of the internal vasoconstriction, the blood is thickened, or and also there is increase in red blood cells and white blood cells, so the resulting in thickened blood and improved immunity and improved metabolism and improved circulation. Whereas the heart, in the heat, it reduces blood thickening due to vasodilation as the blood flows easily. So so in in heat, when they are exposed to heat temperatures for a longer time, the heart pumps blood at a slower rate but at a stronger pace, whereas in cold it is fast and you breathe quicker. Sorry, the heart pumps faster in cold. Effects on respiration. Cold causes deep inhalation, and heat may result in slow or speed breathing. So in cold weathers, you inhale deep, which is actually the best method. So we during pranayama also we try to include deep inhalations and complete exhalations during the sessions. And heat may also slow or speed breathing. Steam helps clear mucus. When your nostrils are blocked, or when you're suffering from bronchitis or nasal congestions, cold, cough, and sinus issues, the doctors prescribe steam inhalations. It can be either just water or medicated oil steam, which the patient is allowed to inhale for around 10 to 20 minutes with short breaks in between. This helps in clearing the mucus and improving the lung capacity and feeling relaxed. Effects on muscles. Cold increases the strength, temporarily, heat decreases the muscle tension. Warm water enhances flexibility. Like I said, warm water, cold water reduces edema, so it improves the strength, but for temporary time, for a short period of time. Whereas in warm water, because it relaxes and the circulation is improved, it enhances flexibility. The muscles move easily and are more flexible, and they reduces tension. Effects on metabolism. Both cold and heat increase metabolic rate, but at a different paces. Cold improves the metabolism immediately. Hot improves the metabolism at a slower pace compared to the cold when given subsequently. It also enhances tissue repair and helps in improving waste elimination or metabolic waste removal. It could be either through kidneys or sweat, or because of your improved lung capacity. That means you're exhaling more CO2. That is how you're improving your metabolism. Now let's discuss about the common hydrotherapy techniques. Hot or cold compresses. In these techniques, a piece of cloth or hot packs or bags or cold packs or bags are placed on the required skin surface to cure diseases or to improve the health. How? Cold compresses are best for acute injuries, swelling, and inflammation, while hot compresses are ideal for muscle stiffness, chronic pain, and also helps in relaxation. What are the effects of cold? Like I said, in acute injuries or swellings or inflammations, we use cold compresses because it constricts blood vessels, reduces swelling and inflammation, and numbs pain. Whereas the heat that is used in chronic pain dilates blood vessels, increases blood flow, thus helps reduce the stiffening of the muscle and also increases the flexibility. Then comes immersion baths. The best example of this is a hip bath where you sit in a bathtub and submerge yourself in the particular body in particular temperatures of the water, which can either be cold or hot, and rest there for a particular time of period. Now, what are the benefits of cold water immersion? It can help reduce muscle soreness and inflammation after intense exercise by constricting blood vessels. It also may improve mood, sleep, and quality of life. And what about the hot immersion baths? It is soaking ourselves in the hot water tubs which helps in relaxed muscles, relieve pain, and also helps reduce stress. We give, and for few patients, we also prescribe alternative hot and cold immersion baths based on their condition. And then comes steam inhalation, where, like I said before, the steam is can either be medicated with herbal oils or just plain water, which is led to steam, and the steam is inhaled by the individual to clear the sinuses, coughs, cold, bronchitis, or any congestion in the nose or the upper respiratory tract. That helps in relieving from the symptoms, and also helps in improving your inhalation and exhalation capacities. Now, what is a sitz bath? It is a little similar to the bathtub, but in this you don't immerse completely, but you fill yourself until you soak your hips or your buttocks to treat perineal diseases. It works great for hemorrhoids, reproductive diseases, fissures, postpartum recovery. It helps in improving blood flow, relaxing muscles, and easing pain, itching, and swelling. This can be done for 10 to 20 minutes, ensuring your hips and buttocks are submerged. Gently pat the area, dry with a soft towel after, and do not rub the area. This works wonders for PCOS and PCOD disorders in women and improves the reproductive health. And then comes jet showers, where the water comes at a particular regulated pressure that hits on the body surface. Now, this is like a spa like experience which provides a massage and relaxing effect. It can be customized and used accordingly. Now, what are the clinical applications? The clinical applications include pain management in arthritis, in joint stiffness, inflammation, muscle spasms, respiratory conditions, reproductive health, stress, and anxiety relief. What are the contraindications? Severe cardiovascular diseases, open wounds or infections, uncontrolled hypertension, severe diabetes related neuropathy. What are the safety precautions involved? You need to test the temperature of the water before application. Avoid extreme hot or extreme cold in sensitive patients. You should monitor elderly and children closely and ensure proper hydration during your hot baths or hot water treatments. So, to summarize, hydrotherapy uses water's thermal and mechanical properties, improve circulation, metabolism, pain, and relaxation. It is safe when applied with proper precautions. Thank you.